Is widely used throughout the world in the cessation or diminishing of unwanted habits. Very common is smoking cessation. Person smokes, cares not to. Hypnosis is used very well in cases like that. Also, for weight loss, people that overeat for one reason or another, usually due to stress, want to lose weight, again, hypnosis fits perfectly as treatment for that. Also used for, of course, stress reduction. It's a very good treatment for stress reduction. People that are into sports or such physical activities would like to enhance their performance, such as golf, sorted ball playing, running, calisthenics. Again, hypnosis is way up on the list for treatment. Sometimes, quite often, people live such stressful lives, many different stresses in their life at the same time, and for them to relax, even in hypnosis, becomes a little more difficult. Today at this show, what we're going to show is how East meets West. We use the Oriental art and science of acupuncture to relax the person, their body and mind, so that hypnosis that follows, or the treatment with hypnosis that follows, will be a little easier, a little more definitive, a little more well-defined, making the treatment run much more smoothly. I'm here again with Dr. Golding, and this time with Dr. Joseph Robinson, who will be on the show, and we're going to have this treatment that we can show you, where the person is first put into a relaxed state using acupuncture, and then followed by a session of hypnosis. And this is, in this particular case with the woman we have carry, is for stress reduction. This is the Somerset County Acupuncture Treatment Center here in Somerville, New Jersey. You've seen Dr. Golding on this show many times. He's gifted us with immeasurable amount of insight and knowledge to the Oriental healing arts, such as acupuncture and Chinese herbal medicine. This is, of course, Asian Culture in America, a presentation of the Asian Cultural Arts Society. And of course, I'm Paul Schur, the producer and your host. I'd like to introduce to you now Dr. James Golding. Well, Dr. Golding, here we are again, informing the public of Oriental medicine. I think it's been great. I don't know if you've enjoyed the year we spent together, but I think it's great.
Well, very much so, Master Schur. It's a pleasure to see you, and it's a pleasure to be on the show once again.
What are we going to see today?
Tonight is a pretty exciting night, and what we're going to see is something that both myself and Dr. Joseph Robinson have been working on for many years. We are going to demonstrate hypnosis under acupuncture anesthesia. Both Dr. Robinson and I have been practicing clinical hypnosis for 20 years in the Somerville area and have a very successful practice. We also do acupuncture, and we are very successful in the treatment of things such as smoking, weight loss, panic attacks, phobias, concentration and memory, anxiety-related problems, dealing with regression. Something that we had noticed after many years of practice was a certain portion of the patients that came to see us for hypnosis were either resistant or very difficult to hypnotize, or when they were under hypnosis, they were not at a very deep hypnotic state of relaxation to which we could do our job effectively in a very short period of time.
So hence the acupuncture.
So hence we came up with acupuncture anesthesia as an adjunct to the hypnotherapy in helping these conditions.
That sounds to me that that's not too common.
No, it's not common at all. In fact, both Dr. Robinson and I are the developers of the technique.
I'm in the presence of royalty.
Thank you, Master. Sure, I don't think so, but thank you very much.
Well, you're a very innovative medical practitioner anyway, so I would expect every time I see you practically something new is being developed here. This is not a very stagnant center.
Well, I have to say that both of these approaches have been used and recognized by the American Medical Association, like with hypnosis since 1953, and the AMA has recognized acupuncture as an effective tool for many conditions for many decades now.
Mm-hmm.
Hypnosis, in and of itself, is an altered state of consciousness, one in which the mind and body are harmoniously at rest. So hypnosis and relaxation are intertwined. When a person is put into this frame of mind, they become open towards suggestion, and things that normally would not affect their behavior when they're in this hypnotic frame of mind change their behavior and change their actions as a result.
I get from what you just mentioned, that using acupuncture, they can slip into some level of hypnosis easier. Does it also give them a deeper?
Exactly. It's not only a matter of going in and under hypnosis easier. It eliminates the barriers that many times are present within a person's mental framework that prevent them from going into deep hypnosis. Sometimes you may have come up and met with people and said, oh, I tried hypnosis and it didn't work. Very rare do we find that it doesn't work utilizing this particular technique, because acupuncture is relaxing in and of itself, the process, but we have narrowed it down to the techniques associated to what makes a person go into a very penetrating, deep state of relaxation, associated with the foremost optimal state for change.
Okay, I want to ask you a couple of questions, all right? One, people under hypnosis, do they lose control? You know, this thing about, oh, we can make people cluck like a chicken or something.
I would say that that's the foremost thing that prevents a person from going to see a hypnotherapist, is that they don't go because they feel that there's a sense, and a foreboding sense that they're going to lose control, and that's not true at all. You don't lose control under hypnosis. A person's consciousness is not decreased when they're under hypnosis. It's increased 10 to 100 times. A person is very, very aware of where they're at, but they're in a very, very deep, deep relaxed state, much deeper than you could ever be in sleep or in any other frame of mind.
Okay, the other question is, people that say quite often to me and to the rest of the community, I can't be hypnotized. Now, one, we split this in half. Is there such a thing? And two, if there is such a thing, by using acupuncture first and then hypnosis, does that change the situation? Did you understand?
Yeah, I understood you fully. Answering the second part of your question first, the dynamics change considerably when you're doubling up on these two techniques. There's no doubt that we're going to achieve the desired result when we do that. The whole aspect of not being able to hypnotize, that's extremely, extremely rare. A person that's under certain types of medications, that may prevent them from going into the hypnotic state. A person may, on a sliding scale, some people may be more resistant to hypnosis than others, but everyone can be hypnotized. It's just some are easier than others.
Mm-hmm. Now you have Carrie, you said this woman's name is?
Yes, Carrie is with us here today. She has been a patient of mine here at the office, and she had been undergoing chiropractic care, and I had the opportunity to hypnotize her once a few weeks ago. We did a weight reduction session, and she responded very well to the hypnotic treatment. And she has volunteered to be on the show tonight and our guest for treatment. And I'm looking forward to demonstrating this to you now.
Great. So we're going to go into another room and set up? Or?
Correct.
Great. Well, I really am looking forward to this. Not because it's my show. Okay, I've never seen this done. I've never even heard of it until you mentioned it. So this should be interesting to me, and I'm sure the viewing audience.
Stay in your seats.
Well, Doctor, I see you're all set up here with the instrumentation for the electroacupuncture. And what are you doing now?
The whole technique takes approximately a 1 to 2 hour period of time. A person comes into the office, there's forms that they need to fill out, then we take a history according to Chinese medicine and hypnosis in and of itself. Then what we do is that we go on to an examination that includes the taking of one's pulse according to Chinese medicine, which checks for the energetic factors within the body. Then we do tongue diagnosis, which gives us an indication of the person's internal makeup within the body. From that point, we start acupuncture. Certain things are rote or the same for each individual when they come in. These particular points, right in the webs of the feet and down here at the point of the feet, these are called the 4 gates. The 4 gates are instituted to start an acupuncture flow throughout the course of the body. Once these 4 points are initiated, what we then do is that we needle 2 points called stomach 36 right here in the lower leg. Then we start to initiate electroacupuncture. Electroacupuncture is stimulated on these points for approximately 20 minutes to a half an hour, preparatory to the hypnosis session. Then what we do is we utilize this instrument. This is called a point locator. The point locator is used for auricular medicine, and what we do is that the point locator helps us define the adjunctive acupuncture points for auricular medicine that will assist us, and this is a very reactive point right here, that will assist us in the relaxation that we need to achieve for the session. What we then do is that I've already inserted the needles on the opposite side and on that point of the body. We use auricular acupuncture needles, which are called intradermal needles, and these actually stay in the ears. They can stay in the ears up to 2 to 3 days after the session. What we'll find is that the relaxation from the session will continue to stay throughout for a longer duration of time and enhance the effect of the hypnosis. What we're going to do at this point is that the patient, what we're going to do with Carrie is that now that we have completed this portion of the session, she will now relax in the room. We have a video set up that you can't see right here, but it's right behind the lights. That video, she will watch a video during the duration 20 to 30 minutes preparatory to the hypnosis session. Depending on what a person comes in for, it depends on what type of visual stimuli we'll want them to witness prior to the session. We'll see you soon.
I'd like to talk to Carrie for a moment.
Okay.
Okay. At this point, with all the electrodes and whatever, how do you feel?
I feel comfortable.
Yeah?
Yes.
Any different than when you were in the other room sitting?
I feel a little bit more on the spot emotionally, but other than that, I feel fine.
Okay.
Yes.
But you're just comfortable and relaxed?
Yes. I feel the center of attention.
Well, you are.
But other than that, I'm great.
Thousands of people are looking at you at this moment.
No,
Well,
I
thank
feel
you.
comfortable.
Okay, Carrie, as we discussed earlier, hypnosis is a combination of relaxation and concentration. So all you have to do is pay attention to what I say, relax, and concentrate. The only thing that will prevent you from going into hypnosis is fear, and obviously there's nothing to be afraid of here. All right, taking a deep breath,
Robinson.
exhale that breath.
What we're seeing at this time, Paul, is that after Carrie watched the video, which was approximately that 20 to 30 minutes, What happened was that I took
Now
out
let
the
the surface
peripheral
tension in your
acupuncture
body
needles
go
and the
away.
electroacupuncture needles.
And focus
The
your
intradermal
attention to the
needles in
muscles
her
around your
ears
eye.
stay in, and the reason
Allow the
why we use
muscles
the
around
needles
your
that are
eyes
flush
to
is so that
completely and
many
totally
times if
relax.
people move around while they're under hypnosis, this will
Use
not
your
be bothersome if she moves her
imagination.
head.
Let the muscles around
So the
your
needles
eyes
are in her
completely
ears in
and
specific
totally relax.
locations according to the
Let them relax to
5-element
the point that if you
theory
tried to
of
open
Chinese
your
medicine
eyes,
and
you couldn't do it
auricular
even if you
medicine.
wanted to.
Actually, what we're seeing now is
Now try to open your
real.
Oh,
It's
yes.
real time. She's
Fantastic.
actually going to go under.
Right.
Hold on to that
This is
feeling
very
of
much in real time, and Dr. Robinson will be using some rapid induction methods to help her bring her there quickly to, keep our interest during the course of this session here today. Now, keep in mind that both Dr. Robinson and I have been trained in 30 different forms of hypnosis, and what he is initially doing is a process called progressive relaxation. That progressive relaxation will help to deepen the sense of relaxation and well-being. Also, he'll then be doing a form of creative visualization, which will allow the person to go into a visualized state of hypnosis. Also, what we found is that by doing the acupuncture ahead of time like that, endorphins are circulating throughout the course of the body. Endorphins are relaxing hormones that will create a natural sedative and enhance the mind-body well-being. This is a true mind-body technique in which there's no separation between the hypnosis being strictly a mental technique and the physical aspect of the acupuncture.
This woman, Carrie, has been hypnotized before, I think you said, huh?
Carrie had been hypnotized once by me before, 2 weeks prior. I have known her as a patient for approximately 2 months, and she was a good hypnotic subject 2 weeks ago.
You can sort of see that now. She's doing very well.
Right. We do so much hypnosis here at the center that
a wet dishcloth is incapable of doing anything. It's just limp, wet, and sagging.
React and relax.
And what I will do is lift your right hand several inches off of the chair, and as it gently drops back down onto the chair when I let go of it, you will imagine yourself becoming 10 times more relaxed than you already are. Now begin to imagine that your right hand is like a wet dishcloth, completely and totally relaxed and limp. I'm now going to lift it several inches. You're doing great. 10 times more relaxed. Good.
An atavistic state of hypnosis is an extremely deep state of hypnosis, one in which you could, many times they'll do things like surgery or do, make a person's body very rigid, but it allows for an extremely deep state of hypnosis.
Left hand several inches off of the chair. And then as it drops down, as I let it go, you will imagine yourself becoming twice as relaxed as you already are. Now begin to imagine that your left hand is totally relaxed, like a wet dishcloth. I am now going to gently lift it up. Twice as relaxed. Great. Hold on to this feeling. Don't let go of it. You're doing great. You have now proven and seen that you could relax physically. What you need to do now is relax mentally.
Where we're at now is that Dr. Robinson is deepening the induction of the hypnosis. First, we initiate the process of relaxation, and then we go through a repetitive process using different mental overlay to deepen the state of hypnosis more and more and more.
And then you will allow the rest of the numbers to simply fade away and disappear. If you do this correctly, by the time you get to the number 97, the rest of the numbers will simply have faded away. You will have banished them from your mind. You could do this. I can't do it for you. All you have to do is want it to happen, and it will. Just tell yourself it will happen. Okay, now, when I tell you, begin counting slowly backwards from 100. Begin now counting out loud, slowly backwards from 100. Twice as relaxed. Good. twice as relaxed. Good. Now start letting the numbers go. Good. Let the numbers go now. Banish them from your mind. You don't want them and you don't need them. Go deeper, relax. Hold on to this feeling. You're doing great. Let the sounds fade away and just pay attention to the sound of my voice. And now we're going to go to the basement of relaxation, where we're going to do our important work this evening. And the way you're going to go to the basement of relaxation is by imagining yourself getting onto an escalator and descending down 3 levels. First to level A, then to level B, and finally to level C, which we will call the basement of relaxation. And remember, an escalator requires no work on your part. All you have to do is get on the escalator, slowly and effortlessly descending down to the 3 levels.
Where we're at now is that Dr. Robinson is deep into the state of relaxation to the point where the patient is in the hypnotic frame of mind at this time. I can tell just from standing off in the distance that the patient is listening. Physiological relaxations that will also indicate the hypnotic state of relaxation. She is in a REM state where we have a rapid eye motion going on. She is also at a point of where her body is doing a physiological unloading, meaning it's taking a lot of the tension and tightness, pressure and constriction that may have been a portion of her life for a very, very long time, and is eliminating it. It's eliminating, it's shunting it from the body. Many times, a lot of mental and physical processes on a negative level that happen to us have a tendency of constricting or holding within muscles of the body. She is going through a deceleration process and elimination of that tension at this point.
And remember to signal me when you've arrived by lifting your right hand. Now go deeper. Hold on to this feeling. Don't let go of it. We're now going to go to the... Now relax and go deeper. Let the sounds fade away and just pay attention to the sound of my voice. And in a moment, you're going to develop a dry, cottony feeling in your mouth. Your mouth is going to get so dry. And what I'm going to do is count from the number 3 to the number 1.
Now is the
and when I get to the number 1,
you can create a physical reaction, a physical experience by the patient just by using suggestion. You're looking at her actually physically experiencing this sensation within her mouth.
And when you get that dry, cottony feeling in your mouth, that's your body's signal to drink water. Clear, plain water. At least 10 8-ounce glasses of water every day. When you get that feeling, you will drink 10 8-ounce glasses of water a day. It's your body's signal to drink water. And what that water will do is cause you to urinate more and act as a natural diuretic, which will cause the fat to come out of your body. It will help you in your weight loss. Now relax and go deeper. Let the sounds fade away and just pay attention to the sound of my voice. And in a moment, I'm going to begin to emerge you from this state of hypnosis. And when you emerge from this state of hypnosis, you will feel secure, you will feel at peace, and you will feel confident in knowing that you now have the tool that's necessary to lose weight. And you will remember that hypnosis has a cumulative effect, and the more you utilize this method, the more powerful it will become. The way I'm going to emerge you is I'm going to count from the number 3 to the number 1, and you will only emerge when I tell you to do so. Number 3, feel the energy returning to the muscles in your body. Number 2, imagine a cool stream of water running over your eyes, beginning to awaken you. And when you emerge, you will emerge feeling comfortable, feeling confident, and secure in your new weight loss program. Number 1, emerge feeling great. Oh, that was very good. That's good. How do you feel?
A little floaty.
A little floaty?
Yeah.
And do you understand everything that I told you?
Yes.
Do you have any questions about the techniques that I told you to utilize?
No.
No. And actually in hypnosis, people remember things much greater than they did when they're not in the hypnotic state. So do you find yourself remembering exactly what I told you to do?
Yes.
Okay.
About the drinking the water and only half.
Right.
Yes.
Half of the food that you normally eat.
Yes.
And what are you going to do if you get hungry between meals?
I only have 3 meals a day.
Right, and if you get hungry between meals, if that so happens, what will you do to avert that? To avert eating between meals?
Oh, that I can't remember.
You'll take in a deep breath, close your eyes, and say silently but forcefully to yourself, this feeling will pass.
In 5 minutes.
That's right.
That I remember. I remember the 5 minutes. Thank you.
Okay. You're welcome.
How about we ask Carrie how she feels at this moment, now that you're out of the system in a sense?
I feel really relaxed. I enjoyed it. It's a very soothing, very cleansing for me. I really, it's something special.
And did you really, when you came out of the hypnosis, you can remember just about everything that happened?
Yes. Yes, I can.
Especially the important parts?
Yes, and if I happen to maybe misplace something, it's just a very slight prompting to help me draw it up to my conscious very easily.
Dr. Robinson, how was she as a subject for you?
She was an excellent subject. She was able to concentrate and relax at the same time, and it was a pleasure working with her.
Great. Oh, it's a nice chair, too.
Yes.
Very comfortable.
It helped.
Dr. Golding, why don't you tell the audience something?
This is a wonderful technique for eliminating negativity within the body and eliminating barriers that have a tendency of preventing us from change. Many times in our lives, we all have the repeated same scenario of weaknesses and challenges throughout the duration of our lives. This offers us hope and opportunity to step above and beyond this so that we can move our lives forward and spend our energy in more utilizable directions. Thank you for watching.
Of course, I'm Paul Scher, and I'm the host, and I know this is my show, but I really have to say I really think that this was a really great show. And I want to thank Dr. Golding. I want to thank Carrie. Is it Carrie Harris?
Francis. Carrie
Francis. We didn't get to talk too much as you were sleeping. And Dr. Robinson, thank you for being on the show. First time for you.
Thank you, Paul.
And keep watching. This is Asian Culture in America, a presentation of the Asian Cultural Arts Society. And as I said before, of course, I'm Paul Scher.